Hey, everybody, welcome to another wonderful episode of MedNation, where medicine meets real talk. I'm Dr. David Farnin, a board certified podiatrist and foot and ankle surgeon based in Nashville, Tennessee. This podcast is all about diving deep into the world of healthcare, innovation, and the stories that shape medicine today. Whether you're a fellow clinician, a healthcare enthusiast, or just curious about what really goes on behind the scenes in medicine and pharmacy, no pun intended there, you're in the right place. Let's break down the science, plus some myths, and have real conversations with the experts shaping the future of healthcare. This is MedNation Podcast. Let's get started. So, everybody, today I'm sitting down with someone who's not just disrupting the pharmacy industry, he's rebuilding it from the ground up. This is Dr. Vinay Patel. He's a pharmacist and the founder of Makorx, a company that's taken on the bloated, overpriced, and often confusing world of prescription drugs. If you're tired of the status quo, if you think drug pricing is broken, if you want real transparency and actionable solutions, Vinay is your guy. He's got opinions, he's got answers, and he's got a vision for how pharmacy should actually serve patients, not middlemen. Today, we're talking about the future of pharmacy, the ugly truth behind PBMs, and what it's going to get American the medications they need without getting fleeced. Vinay, welcome to the show. Let's get into it.
Thank you so much for having me. It's an honor to be here.
I was able to read about your history, about Makorx, and tell me a little bit about yourself.
I'm a pharmacist, as you mentioned. I've been a pharmacist for longer than I can count now, close to 20 years, and just worked in various different areas of pharmacy. After pharmacy school, worked in academia, teaching pharmacy students and medical residents and medical students, worked for the state here in North Carolina, have worked in health systems, worked for community health centers, and independent pharmacies, regional delivery home delivery pharmacies. It's been run the gamut, really, a little bit of everything. And it's been a fascinating experience in the patient care settings throughout all of these areas. The common thing that you get is that there are pharmacy benefit companies that essentially dictate, what you get to tell patients, how much money you get to make as a pharmacy, and just, some of the crazy restrictions and rules that they place on pharmacists and pharmacies.
Yeah, so that's a perfect segue. You've called out the PBM, system as broken and predatory. What's the number one thing most patients and doctors still don't understand about how PBMs impact drug pricing?
I'd say that there's three big things that pharmacy benefit companies do that most people don't realize. One is they tell you where you can go get your medication, so they they restrict or navigate you to specific pharmacies, sometimes pharmacies that they own, to get medications, whether it's through the mail or at your local pharmacy. They tell you how much your medications will cost. Essentially, they're setting those prices or dictating what those prices should be, and then they're telling you which medications you're eligible to receive, and that's through formulary. So these three things are just being done in the background. It all lives through the insurance card that you have in your wallet, and there's three big pharmacy benefit companies that run pretty much 80% of all the prescriptions that get processed through the country, all the prescriptions on a yearly basis.
Let's shift gears to Makorx. It promises true price transparency and direct access for patients. In your bluntest terms, what's the real obstacle to making this the new standard, and who stands to lose the most if you succeed?
That's a powerful question. So the biggest obstacles are really, and in our belief, is that the employer market, that's 55% of folks in the country get their health insurance through employers. And so they have a lot of leverage. They have a lot of weight in the healthcare marketplace. The decisions that they're making are really blocking that substantial change that they could affect in healthcare. They could really be tackling high drug costs and runaway healthcare costs. And really the system that we have today is partly due to not taking any action, just, sort of letting the system take its own course without really taking the healthcare system by the horns. So that's really been, and there's various different reasons for that. It's not just the employers sort of saying, they're resistant to change. There's many employers that welcome innovation, healthcare, new models of healthcare, but there's, an entrenched system now that they're fighting an uphill battle against. And one big decision they could make is choosing who they deal with for their pharmacy benefits. They have the choice in their health plan for these large employers, not the small ones, but large employers. Anyone over 100 employees typically has a self-funded health insurance plan, and they get to choose who they want to pick for their pharmacy and medical insurance health stack. And that's really could influence a lot of change. So if they decided differently, if they decided to use more smaller, transparent PBMs, they could really affect the change. And the people, the entities that would lose the most are the vertically integrated insurance carriers.
Hmm. And let's take a step back. Talk to me about founding Makorx and tell me about obviously what makes you guys different and special, and so I can tell our listeners that.
Yeah. Yeah. So, as I mentioned in the beginning, the sort of common theme doesn't matter where pharmacists work is, the invisible hand of these pharmacy benefit companies. In 2018, myself and a group of pharmacists decided that we wanted to create a whole new model or system for pricing medications. And so what we did is we created this cost plus model. I know cost plus is very well known across the country today because of Mark Cuban and his messaging out to the country around his cost plus drug platform. The biggest difference between what we had created then and sort of what Mark Cuban has today is that we have a network of pharmacies that you could walk into, close to 20,000 pharmacies across the country. And we advocated and encouraged folks as we worked in the employer market to go get your medicines locally, go work with the local pharmacy. Doesn't matter what that is, which pharmacy that is. We have access to certain pharmacies at cost plus, but we have access to all the other pharmacies as well. And make sure you have access to your medicines. Make sure you have a relationship with a clinician, a pharmacist in your community to help you and guide you and keep your family healthy. And so that's really what the core of our model was cost plus pricing for drugs, all drugs, and really get to a model where if a generic lower cost medication was available on the marketplace, employees had access to that on their health plan, and they could save the most at the pharmacy by getting access to these generics, and we could and also save their companies, their employers on their healthcare costs by choosing these lower cost alternatives. And so we're optimizing the formulary that way as well. When in 2021 there was generic insulins widely available, but most large pharmacy benefit companies, large insurance carriers weren't providing access to those to the general public through the insurance formularies.
On a side question, do you think there'll always be a brick and mortar CVS Walgreens, knowing that all these PBMs and all these companies, like, let's say, for example, me, I use Walmart, or not Walmart, I use Amazon Pharmacy.
Uh-huh.
It's been pretty seamless. It's pretty quick. It's kind of a no BS mentality, no BS model, as opposed to a Walgreens or CVS. Do you ever see CVS, Walgreens I'm not going to say being ever shut down by any means, but ever, being less popular in the public eye?
Just like in general, chain or big box store pharmacies being less popular, or just
Correct.
local pharmacies in general? I do think the business model is changing very quickly, very rapidly. I think that what you're seeing at CVS and Walgreens specifically is a consequence partly from the vertically integrated insurance carriers' specific models in how they are extracting revenues from every single entity in the healthcare supply chain, from pharmacies to members to employers to drug companies. And so, is there going to be a need for them? There's always, in my belief as a pharmacist, I think there's always going to be a need to access certain groups of medicines right away. If you're particularly sick or if you have an urgent condition, you're going to want access to medicine, the same day or within a couple hours, if you will, of any specific injury. Not all medications. There's plenty of medications. There's also issues where getting medicines in the mail can cause delays, or if there's certain refrigerated medicines that can't make it through the summer temperatures, it's ineffective. And then some, people still have to walk in and get medicines, just from a local pharmacy as well. So I think that their business model is changing significantly, and it's going to look differently in 10 years or 5 years from now than what we have today, and sort of this traditional, very high cost brick and mortar locations all over the country. Whereas you may get more smaller, nimble stores that are focused just maybe on pharmacy, and there's not a big front end, and you have just limited access to specific medications that they would stock at these smaller locations to get people started on medicines, and then the rest would just, as you said, come through delivery.
Walk us through a moment where you knew the traditional pharmacy model was beyond fixing. What was the breaking point that pushed you to start Makorx instead of just staying in your lane as a pharmacist?
Yeah, it was really hearing from community members. These are patients that walked into pharmacies that I worked in, and they would report it. It became more of a chorus than just one-off messages where patients would say, hey doc, I got to figure out if I'm going to afford my rent this month or medications or food, and you're going to have to help me choose because the cost of my drugs are just getting way too expensive. And then on the flip side, from employers in our state reporting that drug costs are getting more expensive, it's becoming harder and harder to figure out how to afford healthcare benefits for their employees, and why, what's behind all of this problem. So we saw a unique opportunity to help the employer market, specifically in healthcare. There's, a wide swath of different ways to access healthcare, depending on your age and certain financial, socioeconomic and financial circumstances, how you can get health insurance. Staying, just focused on the employer market, we saw a huge opportunity to help them choose better and give them education and awareness of different options, and then also help at the same time help employees lower and make drugs, more affordable. Most of the drugs, about 87% of medications that are filled in the country are generic medicines, and those should be the most affordable medications. And that's where people are saying that, drugs are really expensive. And from a pharmacist perspective, we saw it. Why? We saw how much we were buying the drugs for, and why should it be, a markup of sometimes hundreds or thousands of percent over what the purchase prices of medication. So they should still be affordable, and that's where we had a launch off point to see if we can tackle that. And little did we know that there were so many barriers that were unforeseen to us as from a pharmacy perspective on all the different layers and complexity of healthcare that keeps the status quo the way it is. And then we learned a lot.
Yeah, I'm sure. So let's talk risk then. You're taking on some of the biggest players in healthcare. What's the boldest bet you made so far, and how do you keep from playing it safe in an industry obsessed with the status quo?
I think that everything that we've seen over the last 7 years, it just emboldens us to push the envelope more and more every year to find unique and creative ways. What I've told certain strategic partners is that, look, we'll never be able to beat the largest players in the industry by playing their game. So we'll never be able to beat them at chess, right? If everyone's playing chess, we got to figure out how we're going to play checkers and find just these unique ways to penetrate the market through different solutions, creative solutions that only smaller, more nimble healthcare partners, as a network of partners, not just us alone, but as a group of healthcare partners, really come to market with a unique solution. So we've come up with a couple of unique solutions. We're not afraid to be the martyrs. If our solutions don't work, but we've taken our best shot at it, and we know that it was to do something that could help change the lives of millions of people, and we are willing to take that chance. And I think more and more we're getting more riskier, if you will, just sort of in our solutions that we're developing on a regular basis. But the biggest bet that we've taken so far, and it's so far been well received and well paid off, in the sense that in January of this year, we and part of our parent organization merged with a company called Proactive MD, and we are now offering a product within Proactive MD called Proactive RX that's embedding pharmacists inside of employer clinics. These are on-site employer clinics for larger manufacturing, municipality, employer groups, that is offering consults not only to the providers at the clinic, but also to the patients of the clinic to educate them on drug costs and therapeutic alternatives and certain specific drug savings programs that they can access outside of their health plan direct with either drug manufacturers or directly with savings programs that we built that will hopefully show a significant amount of influence that these employers can take without having necessarily to change their health plan. We're not looking to again, disrupt their health plan or create, be a new vendor in their health plan stack. We're coming in from a clinical perspective from their primary care clinic to really embed and show them that there's better patient outcomes, better care for their patients, and then access to savings as well, based on some of the stuff we built.
Incredible. So, is there a time or, I always like to talk through stories as well. Do you have any behind the scenes moments when you hit a wall during your approach to this as a pharmacist, or any real patient stories where Make RX made the difference?
Oh man, there was so many stories. We just this morning we got an email back from a patient who's part of an employer group here in North Carolina, and he wrote back to us, and he was having a pharmacy issue, and our team was helping him resolve that issue at the pharmacy, which we were able to do within 48 hours of his request versus sometimes waiting weeks for a response from larger insurance companies. And in his response, when we were taking care of his issue, he said, "Oh, and by the way, I want to let you know that I'm so glad that you connected me to a local pharmacy. The relationship that I've had with that pharmacist and the way that they've been able to take care of me and my family has been invaluable. I would have never been able to connect with a local pharmacy had it not been for Makorx, because of our, again, advocation and promotion for folks to utilize and leverage their local pharmacies. And there's nothing special about getting their drugs in the mail. A countless number of times we've helped families understand how they can access lower cost drugs based on, what their doctor had recommended and what alternatives were available, just helping patients navigate pharmacy. Pharmacy is extremely complex, and having a team that specializes in helping people understand all the components of how pharmacy is structured and how to help them navigate to get them access to the drugs that they need affordably. So, it's just so many stories around that. I can tell you that in the beginning, some of the barriers that we had speaking of hitting a wall and really, in that first model that we had several failures and lessons learned around the complexity of healthcare. So when we go talk to employers, they said, "Oh yeah, that sounds amazing. Love the program, love the model. Why don't you talk to my third-party administrator? Why don't you talk to my healthcare consultant that helps us?" And there were so many conflicts of interest talking to all the other healthcare partners in how they were monetizing or how they were incentivized to keep, again, the status quo the same. And we realized that the majority of healthcare just wants to keep it the way it is because there's too many entities, too many middlemen, if you will, in the healthcare supply chain that make too much money to be able to give up that revenue. And so we had to find these uniquely positioned partners, whether it was healthcare consultants or third-party administrators or stop-loss carriers or employers for that matter, that really had the desire to influence change because they, were in industries that really couldn't afford double-digit increases in their healthcare premiums. Finding a solution around replacing that insurance card with a full stack solution and not just being the point solution that we were with pharmacy benefits also helped us pivot and find some opportunities. So many learnings and failures.
For every frustrated patient or physician listening who feels trapped by high drug costs and red tape, what's one action they can take today to start changing their reality, or at least push their own pharmacy experience in a better direction?
Yeah, that's a great question. It's because there's so many different types of insurances. When you talk about all the different ways patients and providers interface or access healthcare for their patients, it really starts with understanding that there are ways to counteract the existing system. So, practitioners, medical providers practice in a way that they've learned that helps their patients in the best way possible. And everyone has their own unique ways to practice based on the environment that they're in terms of the healthcare infrastructure. Based out of that, when there's, the biggest frustrations we hear from providers are so much prior authorization paperwork, and there's a whole team, army of folks in provider offices that help with that. There are ways that we can help the patient go direct to the insurance company to help get some of these rejections that they receive appealed, and also there's plenty of AI solutions now that help patients draft or generate appeal responses based on their specific medical situation, to help counteract some of the denials that they receive. That doesn't have to go through the doctor's office, so that patients can go direct. And insurance companies are typically more willing to listen when it comes directly from the patient versus the traditional doctor, supplying a medical letter of necessity. The second thing is that to realize that, there's so many more drugs that are available at low cost options directly from pharmacies without using your insurance, without having to go through all those hoops and hurdles. Sometimes an insurance company will require you to take the higher cost brand medicine and charge you the higher cost when there are alternatives available. And there's a couple of factors there. One is know what the treatment alternatives are and where there are lower cost alternatives. Ask patients to ask their pharmacies when they go in what the cost would be without their insurance, regardless, just paying the pharmacy at the direct cash price. And then have a relationship with at least a few pharmacies or pharmacists in your community where you can sort of reach out and say, hey, I got this really big issue problem. Typically, the mom and pop independent pharmacies have more time to do consults like that versus the big box stores. They're equally qualified pharmacists, just the big box chain stores typically don't have the time to spend in consults, whereas the other smaller hometown pharmacies do. And so those are just a couple of things that could help, with how we have to navigate in today's environment.
Got it. So I like the shift also, let's talk a little bit more about MakeRx. Let's get specific here. So walk me through exactly how a patient would use MakeRx to save money from start to finish. What's the experience actually like?
So, excellent question. We have two major ways that they interface with us. One is through their employer. So this is not anything that they can do direct, but their employer has chosen us to manage their pharmacy benefits for their employer health plan. And that's, a whole separate implementation integration. But if their employer has already chosen a program that we're involved in, then we would essentially, the patient would have a new insurance card issued when their health plan renews, and it would have our pharmacy information on the card instead of any other insurance carrier's typical pharmacy program. And the patient would be informed, educated that they can use any pharmacy in the country. When they choose a preferred pharmacy in our network, they can find those pharmacies on our website. And when they choose one of those pharmacies and have their doctor send the prescription to one of those preferred pharmacies, they get access to lower costs, co-pays, or cost share. So they can save money, and their employer saves by using one of these preferred pharmacies as well. When, for the 5 to 7% of prescriptions that are higher cost brands that require additional prior authorization, we work with the patient and the provider's office, reach out directly, request those medical records, have a clinical team that reviews it. And then as soon as they're authorized for that medicine, they're authorized for as long as they're on the plan. So they don't have to do annual renewals when they work with our pharmacy program. And then they can reach out to us and navigate, specific issues, questions, concerns that they may not get from their local pharmacy or pharmacist and their provider to help just provide supplemental information, navigation, and education. And then there's another big program that we offer called Complete Care, which is a membership program that can be provided direct to consumers, and that offers over 300 of the most commonly used generics in the country at no cost at preferred pharmacies, and an access to cost plus pricing for every other medication, again, at our preferred pharmacy. So they would just access that by going to our website and finding a plan that would fit their needs, and they would subscribe to the plan, just like a subscription model for healthcare. And then they'd have a digital ID card that would have their pharmacy information on there that they could take their pharmacy and use the program like they would any other program or plan that's available out there.
Seems pretty seamless.
We wanted to make it that way. Healthcare, as much as possible. Healthcare is just not a point-and-click solution, but for the most part, we've tried to simplify things as much as possible.
Yeah, no, it definitely sounds like even something I may be a part of, eventually. But I always kind of like to finish up the podcast with a fun question. It's a if you had a magic wand question here. If you could change one law, one regulation, or one aspect of pharmacy with a snap of your fingers, what would you change and why?
Ooh, so many things to change, but to pick one, if one regulation. So I'll give you an example. Today, the one thing that makes pharmacy so much more complex than anything else, it's a concept called drug rebates. And so there's the price that the pharmacy pays for the drug, and that's just what they buy the drug for from the wholesaler. And then they don't actually get to set the price for the medicine. They have to run it through your specific insurance as a patient, and then the insurance company tells them how much they have to sell that medicine for. That price that they have to sell the medicine for actually has additional discounts in there on the back end that the patient never gets to see at the pharmacy. They have to pay the full sort of retail cost for the medication. And then on the back end, between the drug manufacturer and the insurance company or the pharmacy benefits company, there's a drug rebate that's submitted to lower the cost of that drug. And we're told that most of those drug rebates get passed on to employers. How much of that and what is really confusing. And that's the big part here, is that if I could change one law, it would be to change the safe harbor benefits that drug rebates have. So if they could, it would take basically less than a page of legislation to change this rule and just create drug rebate or ban drug rebates from the drug pricing system. And then everyone's incentivized to lower drug costs because there's no more rebates in the system that's confounding, confusing, conflating drug prices. And that could help change it would just create a domino effect in the pharmacy infrastructure around incentives and the price for drugs. Everyone would just be looking at one price and saying, that's what everyone pays. How do we get that price lower instead of higher and paying bigger rebates like we do today?
Yeah, that sounds incredible. That makes sense. So, basically that's the end of our podcast. I want to thank you for being a part of MedNation podcast today.
Thanks for having me. It was a great conversation.
Absolutely. And I had a blast and I learned a lot too. And so, do you have socials as well? I'd love my subscriber base to follow you.
We do, yeah. So we're on LinkedIn primarily. You can find us at Proactive MD. You can follow that page and that listing. And then we also have a Makorx page that you can follow. You can also find me personally on LinkedIn. Love to start conversations and have sharing healthcare ideas with anyone on LinkedIn through my LinkedIn page as well.
So everybody, that's a wrap for this episode of MedNation. If you enjoyed the conversation, make sure to subscribe so you never miss out on the latest in medicine and healthcare.